Good afternoon. I'm Betty Jacobs, professor at Georgetown University, welcoming you to this panel discussion of diversity in healthcare. It's an exciting afternoon we have to share with you about career opportunities and some experiences that other Georgetown alumni have had. We are going to do a sequential introduction by the panelists who will each address the issue of what it is they do, how did they get there, and some reflection or comment about their Georgetown experience as it relates to what they're doing now. You have the bios of a remarkable group of women who have either intentionally pursued an interest in healthcare, but are doing things with job titles that don't fully embrace the scope, range, and opportunity within this industry. We will take 10 minutes for each of the panelists to speak, answering those questions that I've laid out. And if you have questions for the panelists, you may write them in a chat. We'll try to address those in the time we have. But all of the panelists are willing to have their emails and LinkedIn information accessible if you want to do a follow-up with any of the panelists. The first panelist I'd like to call upon is Dr. Tamika Auguste. Tamika, will you please tell us some of the things about exactly what you do and how you got there, and do you think of Georgetown sometimes?
Absolutely, absolutely. Can you all hear me okay? Yes?
Yes.
Okay, great. Well, thank you first and foremost for having me on this panel. I am excited to speak with all of you and take questions, but also to tell my story. I think that it is perhaps a unique story, and I think it's a story that hopefully a lot of people can identify with. I am the quintessential, always wanted to be a doctor my entire life story, that I did not fall into healthcare. That was my path since I was about 4 years old. I am also first generation American. Both my parents are from Trinidad. I was born here. Education is a priority in my family and our culture. You're either a doctor or a lawyer. That means you have reached the pinnacle. And I say that as a joke, but with all of that, you know, going through school, I was always a great student. But I have to tell you that I was not prepared for the rigor of applying and going to school, for medical school. I was always a great student. Studying came easy to me. And then I hit undergrad, which was not at Georgetown. And it was a wake up, and I did not have the tools to course correct or to pivot. You know, I was not the best candidate for medical school right off the bat in the more traditional way. So what happened? I mean, the thought of not going to medical school really was crushing, and I didn't know what to do. Then came along Georgetown, and Georgetown has a post-bac program called the Georgetown Experimental Medical Studies program, or the GEMS program. It's a post-bac program that you know, focuses on your pre-medical sciences and helps to prepare you for medical school. And I am not a marketing ad or anything, but that was the most transformational year of my life. And it really helped me be the doctor that I am today. I was very successful through GEMS. It was also the hardest year of my career, of my professional year, by far. Even past residency, first year attending, everything, it was the hardest year. I got through GEMS, and then I was very fortunate enough to be accepted and matriculate through Georgetown School of Medicine. It was there that I always said I wanted to be a family medicine physician. I had a great family medicine doctor that I emulated and wanted to be like. And the funny joke is that my first rotation was an OBGYN and I loved it. And I was like, this is great. And I can do this in family medicine. And then I got to pediatrics and it was a different story. I did not enjoy it. And I was crushed. I'm like, how can I be family medicine if I don't like children? Like, that's an oxymoron. So I was in a crisis. And I loved OBGYN, but at the time, everyone was like, it's a terrible lifestyle. You can't do X, Y, or Z. And I was just like, I have to find something else. But I always spoke about OBGYN. It was always, but in OB or in GYN, we do this. And folks were like, so you're going to be an OBGYN? I was like, no, not me, not at all. And they were like, but you talk about it all the time. So fast forward, I went away for winter break, came back and said to everyone, I'm going to be an OBGYN. And everyone was like, yeah, we saw that coming a mile away. And so, let me tell you what it is. I enjoy delivering babies. I love doing surgery. I love the connection that I have with my patients, with the women, and being a part of their life as early as their teenage years and taking it all the way through their elderly years and everything in between. So I matriculated through Georgetown School of Medicine and I ended up doing my residency in OBGYN at Georgetown as well. And I have to tell you, residency was hard, but it was also maybe the 4 years where I grew and really, really found friends and friendships alike, as well as medical school. Like I said, GEMS was the hardest year, and the 4 years of medical school was like nothing I had experienced. I, did not come from privilege or anything. We were immigrants in this country, and it really was a real immigrant story. I did not have a lot of resources in the school, and again, I'm not a marketing ad. The school really put their arms around me and helped me through a lot. The school transforms me and helped me be the physician that I am today. Currently I am the interim chair of OBGYN at MedStar Washington Hospital Center. I lead my department of about 60 providers and nurses. We do the highest risk deliveries in the city and the most complicated GYN procedures in the city. We've taken care of the most COVID positive pregnant women in the city, in the region, all with really good outcomes. I am a fierce advocate for women and women's health and everything around it, very involved with the American College of Obstetricians and Gynecologists. And I really am who I am today. I'm the advocate for women and women's health and rights because of the training that I received at Georgetown. I will say that day in and day out, and no one pays me to say it, but it's true. So that's pretty much me. My story, I like to share my story because I think people that are not a traditional pathway will struggle, but I am living proof that you can come out of it on the other side stronger than you ever expected and to do better. So that's my story.
Thank you so much. I'm excited, and I didn't even get to live your story. That's wonderful, very inspiring. Our next panelist is Francesca Lucien, and Frankie, will you tell our audience about your story?
Absolutely. First, I'll say hello to everybody and also say thank you for the opportunity and invitation to participate on today's panel. So I'll start off with what I do. I currently work for a human rights organization that is focused specifically on Haiti, actually, and works in partnership with a local law firm. That law firm was founded over 2 decades ago and works in constitutional and international human rights law, grassroots solidarity, and really looking at how to build networks and coalitions to not only advance justice, but I think importantly, push for recognition and accountability to human rights in Haiti. So a little bit different than what one would expect when talking about a career in health. But prior to this role, I had worked for several years in global health, and I think the through line that is kind of links my work in health and the role that I have right now is really one of wanting to work in service of other communities. And that's something that, really drew me to Georgetown and the Jesuit tradition of service. And so I came to Georgetown in the School of Foreign Service. I studied international politics with a concentration in security. So again, not what you would immediately think of when you think of somebody with a career in health. But over the course of my time in study at SFS, I really, as I said, I was concentrating in security, but I was then taking on a lot of coursework that, introduced us students to thinking about security beyond these traditional paradigms and thinking about security in the sense that it encompasses much broader socioeconomic dynamics and development. And so that kind of really sparked my interest to think about, a role that would include service, but maybe goes beyond kind of the traditional foreign service career itself. After undergrad, I went into communications and advocacy. That was a very intentional move, actually. I knew that I still wanted to do international oriented work, ultimately come back to some sort of international affairs or development sort of career, but I felt like it was really important to learn how to effectively communicate. I personally have felt that that's not one of my strongest skill sets, whether written or verbal. And so, moved with intentionality to go into a career to learn those tools and learn those skills. With the idea that any work that I would do in policy or in community-oriented service would require being able to effectively communicate kind of the ideas, the policy, and most importantly, communicating with the intended beneficiaries of those. So I worked for about 3 years in communications and advocacy, knew that it was the right time for me to go back to graduate school and just kind of carried those lessons I got from my undergraduate experience and decided to focus my studies on this nexus of development and health. I was fortunate after graduate school to join an organization that has a long history of recognizing the social determinants as a very intrinsic component of health, and an organization that really approached the work of health service delivery and strengthening of public systems through this lens, through not only this lens of the interrelation of health and socioeconomic conditions, but importantly, staying really rooted in that work, and rooted in a human rights framework. And so I spent 7 years there, first working in Haiti for about 5 years post-earthquake, and that work spanned, health workforce development around physician and nurse training to help rebuild the health workforce in the aftermath of the earthquake, clinical operations, health financing, HIV, TB programming. I think anyone who works in health kind of understands the full range of activities that incorporates. And then also helping to operationalize the launch of a rural national referral facility. And that was really meant to decentralize kind of this highest level of care in graduate medical education for physicians outside of the capital. I then went on to Liberia for about 2 years, where I first was working in a remote county in the southeast region of the country to help reestablish essential services in the aftermath of the Ebola outbreak. And then later kind of expanded to work on priority program areas and priority programs as identified by the country's Ministry of Health, such as diagnostics and drug-resistant tuberculosis. And that ended up including, support and working together with the team to operationalize the decentralization of comprehensive DRTB and patient and outpatient services, with this idea of really bringing care closer to communities. The organization that I'm involved with now they're not involved in direct service. And so it's a bit different than working for a global health organization. This organization, the Institute for Justice and Democracy in Haiti, is more broadly focused on human rights and constitutional law, and specifically working to defend rule of law, enable justice, and push for accountability. That said, I think in many ways for myself, I do see it as a continuation of the work that I've been doing for closer to the better part of a decade to support strengthening of public sector systems to ensure availability and accessibility and quality of health services which, of course, when we kind of take all of those things together is really the definition of this right to health. And, our organization, we're addressing health, the right to health, and other rights from the perspective of international and domestic law. Looking at what are those responsibilities and obligations of the state and international actors, how this really comes back to the rule of law and capacity of institutions as the foundation. And so in one sense, it's kind of like zooming into the specificities of the duties and responsibilities from a legal perspective, but also zooming out in the sense of like, what are these conditions necessary for basic rights, including the right to health, to be effectively realized and protected as part of the obligations of states to their citizens. So it's certainly taking on health from a different perspective, but one that I very much am excited to kind of build on the combination of international study in international politics, and then also the work of being in an organization that was focused on direct service to now take on this role.
Can you hear me now? Okay. Our next panelist is Tanya Rana, and I'm looking forward to hearing Tanya's story. So Tanya, will you start?
Yeah, absolutely. Can everybody hear me? All right, great. So first of all, thank you for having me on this panel. I think hearing Dr. Auguste's story and Frankie, your story, I'm very humbled to be included in this group. So I will similarly, I'll share what I do now and a little bit on how I got there. And through my story, I think the biggest point I'd like to make to the audience is it's okay if you don't know your destination. I'm over a decade into my career and I still don't know. So I often mark myself as the career journey type of person versus destination. And I used to feel anxious about that, and now I feel very proud of it because you'll see over my experiences, I've just started to gain perspectives across the ecosystem. So I don't think of myself as a specialist, but more so as somebody who's kind of seen the healthcare ecosystem from different angles. And happy to answer more questions on that later. But today I'm working at Pfizer, very proud to be working at the company that developed the COVID vaccine, but I have nothing to do with the vaccine. I actually work in the oncology business unit in a group that's called Global Patient Experience and Solutions. And I'm part of a very small team. And our focus is to look at above product solutions for patients, caregivers, and HCPs. And so very simply put, we manage a bunch of different products that are geared towards helping patients, for example, with their day-to-day life and dealing with their cancer journeys, regardless of tumor type. And again, I got here in a very scenic route. So rewinding all the way back to Georgetown, I was part of what was then the Healthcare Management and Policy program in undergrad, and I majored in psychology. So through that major and minor, I had exposure to both clinical classes. I did actually start off as pre-med. Dr. Auguste, your story resonated with me. I grew up with a family of immigrants and, was kind of being pushed to be somehow a clinical provider, but knew in my heart I probably wasn't going to land there. But still, I did I did bio when I joined Georgetown and didn't make it further than then. But the HCMP program did expose me to, international health type of courses, other clinical courses. The psych major is something I think about often in my career now, given some of the human-centered design work I do. So it was a great foundation for me, given that my journey has been, so varied. So after Georgetown, actually while I was at Georgetown as a senior, thinking about what I want to do when I graduate, there was a company called Mercer who came to campus, and I joined one of the information sessions, and it was like a light bulb went out because I realized that you can have a career where you mix, business type of functions with a clinical topic. So I thought, consulting is perfect for me. I went into Mercer. I spent 4 years there. Mercer is a company that does health and benefits consulting. So it's a little bit random that I fell into it. But again, proud of it because it's a great foundation. I joined right when healthcare reform had come to life and was very much top of mind for employers across America, and learned a lot on the qualitative side of, how do you project financial costs and how do you help employees who may not be able to pay for it kind of work through the system. So I spent 4 years there, realized don't want to spend the rest of my life in this career path. So then I went back to school. I got my MBA in New York. And again, it was focused in healthcare, but I started then thinking about the health tech industry. And I spent a summer and then my second year of business school working at a company called ZocDoc, which if people aren't familiar with it, I say it's like an open table for doctors' appointments. And that was a very interesting time because I consider myself at Mercer getting exposure to the payer side. When I was at ZocDoc, even though it's a tech company, the end user is patients. So a lot of the work that they did and the features they released were founded in, what does a patient need and how do we make this complex, fragmented system easy for them? Loved my time there. Realized, okay, I like the strategy or consulting function. I want to stay in New York. But I was a little too risk averse to go at that time into what was a startup early stage company. So I started looking for other opportunities that, again, would keep me in New York, keep me in the industry, put me in a function of strategy that I wanted to be in, and landed at Pfizer. So I really did stumble into pharma, but again, I had the payer side, I had the patient side. So I was like, okay, this next step is not that random. It's kind of another experience that I'm adding in this journey and I can learn more from. So while I've been at Pfizer since 2016, most of my time with the company was actually in their group that was focused in strategy and consulting. And throughout my 4 years in the strategy and consulting group, I helped various parts of the business, from working in clinical trial innovation, working on their rare disease portfolio, working on internal initiatives and kind of change management in a massive company. It's been a lot of exposure for me, and I've learned a lot. And along the way, I've started saying, process of elimination. This is what I like. I want to keep working in a role that's focused on patients, right? So going back to my ZocDoc days, that's what I looked for in my new role, which is where I'm doing patient platform work. But I'm also using the skill sets that I've gained from the strategy world and even the payer side to understand, how, again, complex and costly the system is. And even before my Georgetown days, when I would spend my summers volunteering at a hospital, right, I got some exposure to the provider side, just kind of going in with open eyes. So it's been, again, a scenic route, but a one where I've learned a ton and often think back to my Georgetown days and, the liberal arts education, where you're exposed to so many different topics. And I think that's kind of been the foundation for how I think about my career also. And I feel that kind of exposes me and makes me think differently sometimes. So that's my story, Dr. Jacobs. I know I went through it quickly, so if you have questions, I'm happy to answer now or later.
Well, you've covered a lot of ground in a short amount of time. And I think what you're doing will prompt some follow-up questions. But thank you for weaving in so many important aspects about your journey. Our next panelist is Martina Skorin, and she is going to tell us about some very interesting things that she is doing that didn't come when she started as a Georgetown freshman. So tell us, Martina, what are you doing?
Thank you, Dr. Jacobs. Can you guys hear me okay?
Yes.
Okay, great. First of all, it's an honor and a privilege to be here. So thank you to Georgetown Alumni Services. Thank you to my fellow panelists. I'm very excited to be here and hear all of your stories. I feel very connected actually in a small way to each of you, and we can talk a little bit more about that. I knew as soon as I stepped on Georgetown's campus and I met some of the people that was the place for me. And I hear it just in how you guys describe your experience. For me, I always knew it was going to be healthcare. I was an immigrant and so felt similar feelings from my parents and similar pressure around being a doctor. And then had a very curvy path since then. A lot of it was because my career did not exist when I was on, Georgetown's campus. I'm very much in the startup world right now, but I started off as a human science major. And there were some very critical moments that I can think of off the top of my head where pre-med was not the right thing, but I didn't quite know what that path would be. There was a Healthcare in America class, Dr. Goldenberg, Dr. Filerman, other students and alumni panels like this. So I hope we can have more of these conversations to just open up the doors for our fellow students. After Georgetown, after I took the Healthcare in America class, I almost immediately went to the Harvard School of Public Health and got a public health degree. But I took a year off in between because I always thought I was going to be a hospital CEO. That felt like the right place. I wasn't quite clinical, but I loved systems thinking. I loved the complex nature of hospitals, and did the School of Public Health degree and studied very much healthcare management, everything around hospitals. That was my wheelhouse. And then medical records happened, Epic happened, and we designed Epic. And I thought there has to be something more to the world than the technology that we're seeing. So I moved out to San Francisco, and now I've been through a series of startups. A lot of them are all over the board. Actually, Mercer is pretty familiar with them because I was at Castlight in a similar space. And now during COVID, I actually started doing virtual hospitals, which is also quite interesting. So for all the patients showing up in the emergency room that we would typically admit, we can actually send them home now. They're very high acuity, but we can send them home with technology and visits that actually look very similar to the experience we're having right now that involve PAs and nurses and doctors. And so that's been a very transformative experience just from where can we take our Georgetown education, all the things that we learned, everything from philosophy and ethics to our values around cura personalis and care of the whole person and men and women for others. And that I think is really, all of it comes back to the education I got from Georgetown and the people I met and the experiences I had, everything from international health experiences in other countries to the classmates and hearing other people's stories. So I very much appreciate this conversation. I am going to do a little plug for the Career Alumni Services LinkedIn group. I hope other folks on the line can join just so we can hear other people's stories and really help our current students. Thank you.
So we've taken a step in a direction of recognizing how diverse this is, a sampling. And I had asked the panelists to consider about what their work does for individual health and well-being, but I think everyone has made that pretty clear. Your English professors would all be proud of your communication skills. So I'd like to turn this to the pop quiz and have volunteers raise your hand on the panel about someone who was helpful either early on or during your journey, or maybe where you are now. And what are the attributes of these people? Either someone has served as a mentor for you, or someone whose career and ways of working and contributing are qualities that you might admire. So among the panelists, what say you? Tamika.
Sure. So the minute you started to ask that question, there was one person that came to mind, and it's Dean David Taylor at Georgetown School of Medicine. And Dean Taylor specializes in helping students that need a little extra help in their schoolwork, and so around education. And when I first got to Georgetown, I had mentioned, just because of my history and, as a child of immigrants, it was tough and not necessarily always having the resources and the the capabilities at the time to do well. Dean Taylor saw in me what I had not yet seen in me and knew that I could do this. It was not all rainbows and roses, and it was tough. And what he really did was to not only help me cultivate the tools I needed to do to not just get by, but to thrive and to just be excellent. And that was something that I had not had before in terms of the attention to how I was as a student, how I studied, what maybe my hangups were, and he really took the time in me. Dean Taylor and I still communicate. I often say Dean Taylor calls. I literally will drop what I am doing and answer his phone call because he's probably calling me to help out another student who was very similar to me. And that is just invaluable in terms of what he has provided. Dean David Taylor at the School of Medicine, whatever he needs, he gets from Tamika Auguste. He is the reason that I'm a physician today.
Thank you. Another volunteer panelist. Frankie, I see your mind rolling. So how about if you share with us someone who's been admirable or meaningful in your life?
Yeah, no, thank you. The wheels were definitely turning there. I would say it's hard to choose only one person, and I recognize that's a privilege to be able to say that. I think definitely starting with my time in undergrad, I feel very fortunate to have had, series of professors, but one in particular who I think recognized my intrinsic shyness, right, and reluctance to speak up in class, and was somebody who really kind of pushed me to kind of honor my voice and kind of speak up and share my ideas, which isn't something that comes very naturally to me. So that has been very foundational, and I often come back to that when I get a little bit nervous and a little bit shy to speak up. I think beyond my undergraduate experience and more in the professional realm, I've also felt very fortunate to have several folks that I would consider as mentors. And in some ways, it just happened very organically, right? I think, again, coming back to that kind of intrinsic reluctance to speak out too much, I would spend a lot of times in the various roles that I had trying to observe and learn and look at people who had been doing this work for much longer than me and try to just kind of absorb all that I could from the work that they were doing. And what it ended up leading to was, just a group of individuals who have always been available and willing to hear my questions, answer those questions, and then give advice. And over time, that's organically grown into more of a mentorship relationship. But what I think kind of keeps that going is I very much see them as people that I can learn from, and they're willing to kind of provide the encouragement, but also the constructive feedback to support my growth as a professional, right? So the blind spots that we all have as individuals, to really help there, and it's really a two-way exchange, and I would say that how that's translated into my career growth over time is that honest kind of it's on using the word honest in the sense of like kind of a true relationship, a real exchange, not just I look to them for advice and then I kind of go back to what I'm doing and then I'll come back to them maybe a year or two later, but really like an ongoing exchange has meant that as opportunities come up, they'll reach out to me and say, are you interested in this? That's actually how I ended up in my current role. It was, a former colleague and a mentor and a friend who said, this position is opening up. I thought of you, are you interested? If you are, here's the announcement. And then as I'm continuing to learn in my career, that they're available and that we can have these conversations. And continue to grow from there.
Wendy, I love what you just said. I'm going to chime in just for a second. I love what you just said because I actually was thinking about that as well. There's something about an authentic sort of mentor that you can really connect with. And it might be, a path that you're thinking about that's not, it's not the regular path, but I think finding people that reflect our identities and really help us along the way. I've found that, especially Georgetown people, but people really want to help students, alumni, each other. And there is that instant connection. But I think when it's authentic and we can find these allies that are really supporting us, I really resonate with what you just said.
I think that's absolutely the word, Martina, authentic. Yes, very much so.
And Tanya, how about someone in your life?
Yeah, certainly. I do agree. I feel privileged that there's a couple of people that came to mind when you asked the question, but I'll think back earlier in my career when I was at Mercer. First job, and it was a client services job. So we would, be going into offices of other clients and sitting in meetings. And this person who became my mentor, one of the things that I appreciated, in this authentic topic we're talking about is after meetings, he'd pull me aside and, these are the things that went well and these are the things you should think about for the next meeting. And it felt like a safe space because it was kind of, step-by-step coaching, that real-time feedback. And from there, I felt more comfortable kind of having the higher level conversations about where do I want to go in my career and building that trust with somebody. And the same person who, kind of helped nurture me in the early parts of my career is now somebody who I, have a friendly relationship with. We got in a video conference 2 months ago during COVID, and he's showing me pictures of his grandchildren, and I'm sharing my wedding with him. And it's just, I can talk about my career in a way where he understands what it's like to work with me, but also it's somebody who's removed from the situation and can have an objective point of view on what I'm doing and kind of also hold me accountable to what it is that I set, the objectives I set forth for myself, right? So somebody to hold you accountable and check in with you as well. That's another thing that I find really helpful in a mentor.
Well, this turned out to be a really interesting theme, considering that these attributes of authenticity, of the interpersonal, the affirmation, but also the accountability that people you admire have brought to contributing to your pathway. We have had a couple of questions from the audience, and one is about diversity and inclusion in your organization or as you have experienced it. This is partly because we are celebrating this month diversity and inclusion and women in international work and life. So is there something some of you can remark upon about your organization, workplace, or experience related to diversity and inclusion? Martina, I'll call on you first, since you're San Francisco and the tech industry is notorious for not welcoming women so much. The balance of demographics stands out in particular. So what have you experienced?
I have to take a deep breath before I even start answering this question. It's funny. I think I've experienced it in two ways. One, when I first moved out to San Francisco and I was at Castlight, there was an employee resource group, and I found it very helpful. It actually made me realize some of these elements of diversity are big strengths. They allow us to not only serve some of the people that might connect with us, because they're also a little bit different, but it gave me more opportunity with leadership. I identify as LGBT, I'm a woman, I'm an immigrant, and it allowed me to see some people that maybe weren't seen and gave me some opportunities. On the other hand, Silicon Valley is very interesting with women and people of color in other areas. And I was also at a company where I was the only woman, and I hadn't seen another woman in the workplace for about 6 months. I was employee number 1 at a startup. And that was an interesting experience. But I think what it allows me to do is, really look at things like maternal mortality for women of color, like really see some of these areas that need help, because like we're two people, I don't even know how to describe it, but I don't know, it's really shaped my experience and allowed me to help serve other people in those situations, or hear their stories and really develop compassion and empathy in those situations. So I've seen both sides of it, and I am actually really grateful to have had that experience, because it's really kind of developed me as a person.
Very interesting. And Tamika, you told us something about Washington Hospital Center and their far-reaching participation in the community of Washington, D.C. and the surrounding area. What would you say about your experience and organization?
Well, Martina kind of walked into it too, talking about Black maternal mortality. As an obstetrician gynecologist, it's something that is, when I say close to my heart, doesn't even just cut it. In the world of OBGYN, Black maternal mortality is not a problem that was caused by someone else. It was a problem that was caused by our own people, our own providers. And now we are at a place where we have recognition of that. And now we are doing the work for that. We are doing that work locally, locally just in my department at MedStar Washington Hospital Center, throughout the city, but also on a national level. And, it's hard to hear that, to see that. I have dedicated my life to helping women, and to know that there is a group of women, Black women, that are suffering more than white women. And it's not due to their race, it is literally due to racism. And that's a very big difference. And that is the message that we're getting out, and around other things that we have to do. And my role, especially being a woman of color, it has been, I cannot tell you how many times, patients have come up to me and say, I'm just so glad to see you here. I realized that this was a bigger problem than just what is talked in the media. When I had patients, Black women, there were my patients, who said to me, going along, and like 3 weeks before they were due to deliver, said, hey, listen, don't let me die. I mean, to hear that as a provider of healthcare and that takes care of women, just struck me to my core. It's really hard to put into words, but that is the situation we're in now. The good thing is, we are taking steps because of the recognition. And as long as we, again, talking about it and understanding why it is, then hopefully we can make a difference. So I think that is really important. I think OBGYNs have a voice like no others, especially on the front lines. And then I think it is our responsibility to use that voice. That is my role. That is what I must do. And that is what I've been taught to do. So I'm pretty excited about that.
Yes. Wonderful firsthand voice from the people to us. Thank you. And Tanya, how about your organizations? You've been through a few and had a lot of experiences. What comments would you share with students?
Sure. Yeah, I'll say, whoa, these headphones are falling out, but hopefully you can still hear me. I'll say that in most of the organizations I've been with, they've been large organizations. I've certainly taken advantage of colleague resource groups, be it for women or Asians. And what's been great, in my most recent experience with Pfizer, is these are global groups. So it's not only just being exposed to people who are, identify similarly in your country, but it's also globally, and thinking about how that might look different in different countries. I'll also say that in my prior role in the strategy group, I had the opportunity to do a 1-month sabbatical of sorts. So they have a program where you can apply to be a global public health volunteer. So I had the opportunity to go to Ghana and work in a women's hospital. And so we, volunteer a month of our time and work with the local NGO. It was Farm Access that we worked with, and help them develop some tools for women that were going through their experience in the hospital. And it was something that I've been thinking about and reflecting on in my current job in different ways, which is that if you want to be, equitable and have access to the tools that I support from a global level, what are the different channels in which people access them, and the language you have to use, and the cultural nuances, right? I work in a space of oncology, and there's certainly cultures where it's not as openly talked about. I think about breast cancer. There are a lot of cultural norms around that, and an ability to speak about it. So I think I'm talking about a lot of different things, but what I've learned too is sometimes you have to just put yourself in a different situation, take yourself away from your day-to-day, go to the person that is the beneficiary of the work you're doing, and really understand from their shoes, their experience, and that helps inform what I do in my current role.
Thank you, Tanya. And Frankie, your work currently is in Haiti, a place where, all eyes have turned in different episodes, and particular challenges exist. But what about the workforce and experiences you've had either currently or in the past?
Yeah, so I'll start off with saying, in the past, so with with my current organization and the one that I worked with previously, they're both organizations that have been very outspoken on issues of structural racism and how it perpetuates issues of marginalization and exclusion of communities. And so in this current role that I'm working in, the Institute for Justice and Democracy in Haiti is based here in the US, but we work very much in solidarity with our Haiti-based partner. And part of that solidarity model really works to essentially kind of shift power of the narrative to those with the lived experience. And so really recognizing that, in the work that we do, we really try to not speak on behalf of our Haiti-based partner or on behalf of the communities that we intend to serve, but rather to kind of support and offer platforms for those voices to directly inform the discussion and dialogue about what's happening in Haiti, and to really be front and center in that. And so I think it's an approach that is important overall for how we kind of consider diversity and equity and inclusion, and really being intentional about who is included, how are they included, how are those stories being told, and making sure that those who are living the experience are the authors of the narrative, right? And so that it can inform as accurate a narrative as possible, because as we understand what various communities are going through and what those lived experiences are, that will, the idea is that will then push for the solutions that are most appropriate to those problems to be identified, and that they're identified by those communities for those communities. And so it's a little bit different because of the nature of the work that we do, where we are working very much in solidarity with a country-based organization. But I think the principles, we hope that they're applicable to broader issues of diversity and inclusion.
That was a great response to the person who raised this question. I think it gives insight into your different arenas of contribution, as well as the thoughtfulness with which you're working. We have another question about career mobility. And you're all relatively young alumni, not just out of college. You've had some experience. And so there's one thing about changing jobs and moving up with your job titles. But there is influence and voice and growth of different types. Would any of you care to comment about career mobility as you've experienced it or observed it? Yes, Tanya.
I can go first. I think, you know, all of us probably in some shape or form, even everyone who's listening in, you know, you want to give yourself the next challenge. So we're talking to a group of people who are pretty high functional in that regard. All I would say really, and what I've tried to think about with each of my moves is what is the value that I'm getting from that next step, instead of just the kind of like external validation of having a higher title, right? So I think when I started off, I said, if you have a goal in mind with your career, then your path generally is pretty straightforward, and that's great. I envy the people who know that very clearly. But I think the world is changing. You've heard a lot of us talk about roles that even when we were in undergrad didn't exist at that time, right? So there's something to be said about agility, exposure, challenging yourself and learning new things. So when I get ready to make a move, a lot of the time it's because I'm starting maybe to get, you know, a little too comfortable, not feeling challenged and feeling like I want to learn something new. And what's that next challenge or totally new subject I can add to what I already know, but do it in a way where I can build on what I've learned over the history that I have so I can contribute to the role, right? I haven't really taken a new role that I feel that I've had to start from scratch from. It's always building on the skills that I have, but also giving myself the next new challenge. So that's kind of how I've thought about mobility.
Yeah, thank you. Very interesting. Tamika, you obviously love what you're doing and are doing what you wanted to do at 4 years old. How do you see your career unfolding for personal and professional growth?
Sure. So, you know, I mean, wanting to become a physician, it was never I wanted to become chairman of my department. It was never that I wanted to be on the board of directors of ACOG or anything of that sort. I wanted to take care of patients. And I have, and I still continue to see patients. And as I realized the work that I wanted to do for my patients, to be their voice for the population that did not have a voice, or to, you know, or to guard against the racism that the patients are experiencing, I realized that I needed to do something a little different, something to speak up, to create, whether it's the policies or the procedures that would make a difference, or to be able to have a voice on a national level to do that. And once I realized what is needed, it is all collectively needed. We need those that take care of patients. We need those that speak at a national level. And the way I looked at it is if I had the opportunity to do so, then I was going to take that opportunity. And over a period of time, I mean, I think for the first 13 years of my career, all I did was see patients. That was it, every day, day in and day out. And I served my patients very, very well. And then I realized I have the opportunity to do more on top of that. And that's why I started to become a lot more invested in the advocacy work around women's health, around OBGYN. And then I realized there are barriers because there are things that have to be changed, policy, procedure. Who does that? It's someone that's in charge. Now that's me. And so, again, that's the way I look at it in terms of how I can have an effect on all the things I need and want to do for my patients from different levels. So the one takeaway is if you're given an opportunity and you have the bandwidth and the desire to do it, don't shy away, even if it's outside of what you perceive as your norm. I never, ever would have thought that I'd be chairman of a department. Literally, probably 6 years ago, someone asked me that. I was like, no, I would never. And here I am today, and really loving what I'm doing because I feel like I'm really making a huge difference. So that's kind of how I think I'd like to look at the opportunities that come forth.
Very, very interesting. And Frankie, a couple minutes. How about yourself?
Yeah, well, I feel like Tamika and Tanya just summarized it so well. But what Tanya was sharing about this kind of combination of like, are you building off of your skill set in some way? Does a new position bring additional value to what it is that you want to do? But then also, how are you contributing to that role and to the work of the organization? And the question of kind of like the broader work that of the field that you're in really resonates with me, and I wholeheartedly agree that I think making the decisions excuse me, about when and how to take on new roles really kind of involves this calculus of what can you contribute, what have you also contributed to your prior role, right? Like, have you kind of met the objectives and deliverables of what your team was looking for from you in that previous role? And would that new role bring additional value and still offer an opportunity for you to thoughtfully contribute in a way that builds off of all of your prior experience and skills? And those can be transferable, right? It doesn't have to necessarily be linear. And sometimes I would just say this with the caveat that sometimes it is also okay to pivot in the work that you're doing, that it's absolutely okay to pivot as long as you see that opportunity to gain new skills, gain experience, and contribute in a way that furthers your career goals.
Thank you. And Martina, how about yourself?
I'm just going to build on what these wonderful women said. Frankie, I think you said it a little bit earlier, but really being intentional, and really the way that I think about things is, what is my highest purpose? Where can I add the most value? Not what I can even just add into my toolbox, but how do we provide the most value to the community that we're trying to serve, men and women for others. I mean, that's certainly a Georgetown value. And I do have to say, I mean, even if you pivot totally and you don't know all the answers, there's a Hoya network that will catch you on the other side. They are vibrant, they are willing to help. And then, I've also realized this recently, venture capital, there was an article about women in venture capital in Georgetown putting out, I think we're like the second highest school. That is a highly underrepresented, female category, but that Hoya network really carries us strong. So it's okay to pivot and not know, what you want to do. So that's all I have to add. Thank you.
Well, that is a fitting way for people who have worked hard to get into Georgetown, are looking at opportunities in the future. And in some ways, it seems like this might have been one long Georgetown commercial, but I think it has been clear from the panelists what they have gained and how they have used their experience, their network, and the Jesuit tradition of cura personalis and continuous learning. Remember that all of the panelists are available through email and LinkedIn, and there is a LinkedIn network for those interested in health careers. If you can't find it, ask Martina and the alumni office. Thank you very much to the panelists who have joined, to the audience who have participated. We can't give you refreshments this evening, but we'll send good thoughts and certainly are available. Also, a word of gratitude to the alumni network that has put this together and been very intentional about outreach and informing and growth, not only for students, prospective participants in the healthcare, but for the panelists and an enriched conversation altogether. Thank you very much, and look forward to our paths crossing in the future.
Okay.
Thank you.
Bye-bye.